The commonest allergen is house dust mite. It's responsible for nearly 80% of the cases in India in particular. The other causes can be pollens, pet dander, saliva, fungus, and animals like insects and animals. Insects like cockroach and other animals can be responsible like rat, cat, dog. And pollens are quite common, which vary according to place where the patient lives or moves while traveling. According to ARIA classification, we divide allergies into two categories: persistent and perennial. Persistent, seasonal, and perennial. Perennial is present throughout the year, and seasonal is limited to particular season. The commonest symptoms of allergies are bouts of sneezing, watering from the nose, blocked nose, itching in the nose. Itching is quite a hallmark of allergy, vary from one patient to another patient. The most important thing in diagnosis is history. History is very important and it leads to diagnosis in about 60 to 70% cases. The second comes the examination part. There are particular signs which are relevant to the allergies like allergy shine, bogey mucosa, and allergic crease, allergic salute. These are few signs which indicate allergies. Then we come to investigations. Basically, the most important investigation of all is skin prick allergy test. The others can be specific IgE levels. Total IgE people get it done, but it's not important and not relevant to allergies. It can be raised in other conditions like parasitic infections and all. So I'll focus more on skin prick test and specific IG, though the new tests are coming like CRD is a component resolved diagnostic test for allergies. And there are others like basophil activation test, which is right now not available in India, but it is being done in other countries. For management, we can categorize it into different categories like treatment proper, then education of the patient, preventive measures. We can also add on exercise and immunization, supplements like vitamin D and all. So, treatment proper is pharmacotherapy, which involves the sprays and anti allergic tablets. And there's a treatment called immunotherapy, which is the mainstay and most important of all, as it has lasting results even after completion. It result lasts for 10-15 years. Plus, it acts on the basic cells which are responsible for allergies. So the target cells they are targeted, so the effects are better compared to pharmacotherapy. Allergies, they do not end by themselves. They change their forms, which is known as allergic march. Initially, when the child is around 3 years of age, he presents with eczemas and which is known as atopic dermatitis. Then comes the food allergies. Then comes asthma, and finally allergic rhinitis. The pattern may vary from patient to patient, but this is known as allergic march or atopic march. And the patient can change the form of allergies. In complication, the patient can have sinusitis. He can later on develop nasal polyps, or it can progress to asthma or skin allergies. And sometimes even the other complications can arise, like ear complications like pain in the ear, ASM, and all. It's different as per the age of the patient. We get a good response in young patients, especially with immunotherapy. And children respond best to immunotherapy. In old age patient, we prefer more of pharmacotherapy rather than immunotherapy, because immunotherapy is basically for uh, young patient, early disease, and those who are healthy, non-smokers. So children, they respond better to immunotherapy, and adult, they respond better to pharmacotherapy. Other preventive measures are common to both. First of all, the awareness is very important regarding the allergies. Sometimes the patient keep on tolerating the symptoms and may land up later in complications. So it's very important to be aware of allergies. Once you get to know that you are allergic, then you can implement the preventive measures. First and foremost, we do skin prick test for allergies, and we diagnose to which allergen the patient is allergic to. Like suppose he comes allergic to house dust mite, then the preventive measures will be different from pollens. Since house dust mite is the commonest allergen, I'll enumerate few of the preventive measures for house dust mite. Like there should not be any carpets in the house. The mattress pillows, they should be covered with house dust mite proof mattress covers, which has a pore size of less than 6 micron. Then other things like if they cannot afford the covers, then the alternative is to wash the bed linen, like mattress cover, bed sheet, pillow cover, in hot water more than 55 degrees centigrade. Then they should avoid keeping soft toys in the house. If they want to keep, it should be in Ziploc bags, and soft furnishing should be as minimum as possible. Upholstery should be light. HEPA filters should be used, and dusting should be wet dusting rather than dry dusting. And the use of masks should be promoted. Patients should wear a mask even inside the house as often as possible. For pollens, we have different preventive measures, like he or she should avoid going out for a walk in peak pollen time. Peak pollen time is from 8 a.m. to 10 a.m. in the morning and 4 to 6 p.m. in the evening. The washed clothes should not be hanged outside during this period. Once the patient reaches home, he should take a bath and change his clothes so that pollen is not transferred to bed and household items. And a mask and the goggles should be used while he's out. For a cockroach, a professional help should be taken. Professional sprays and they should be used. Even if you don't see any cockroach in the house, there are hundreds. If you see cockroach, then that means there are thousands. So preventive measures are important, and testing is also important. Then we come to animals. The animals like cat and dog, they should not be allowed in the bedroom. If if kept outside the house, it is even better. Then they should be given bath regularly, weekly bath, and if possible to avoid them, they should be avoided. And one important thing which I want to mention is there's no such term like allergenic dog or cat. They all are allergic. Then for fungus, all the leakage, they should be um, serviced, painted, and plastered. And then there's a paint called fungus proof paint are available in the market. They should be used if the patient comes positive to the mold in the test. Then food items, we can avoid the food items to which the patient comes out to be allergic. For accidental exposures, and those who are allergic and highly allergic, especially to peanut and all, they should keep EpiPen with them. EpiPen is not available in India, but we have a DIY or EpiPen which we make and hand over to the patient.